Bonjour, comment nous y, ou plutôt bon après-midi ou bonsoir. My name is Sandrine and I'll be presenting my reflections on Malcolm Bryan's class about implementing programs in developing countries. This is a mid-course review from a student's perspective. Before getting into the competencies that I have gained from this class, I would like to thank you, Mr. Redding, for taking your time to attend this virtual presentation, and I'd like to introduce myself. So again, my name is Sandrine and I'm a final semester MPH candidate in International Health at Boston University School of Public Health with an emphasis in maternal and child health and program management. I have a strong interest in maternal mortality and malnutrition in international settings, and I would really like to work in program design and implementation in low-resource communities once I graduate. I have experience working in Burkina and Haiti as a public health intern and at Howard University as a research assistant at the School of Pharmacy Department of Pharmaceutical Sciences. So for the past few weeks, my group and I have been working with Farm Access Namibia, and specifically with their mobile clinic services program that they call Mr. Sister Clinics. So Farm Access is dedicated to improve access to quality healthcare in Africa for low-income groups by strengthening the private healthcare sector. Mr. Sister Clinics provide wellness screenings and primary care to people living and working on farms, other remote population, and people living in informal settlements who will not have access to health services or easy access to health services otherwise. So what is implementation? If I were to answer this question for my grandmother, I would probably say that implementation is similar to walking into a room confident and sure of one's abilities to produce quality work and experiencing disenchantment within minutes by your then scope of work. More seriously, my definition of implementation will be that it's a challenging task of translating into concrete steps objectives that do not always perfectly fit with the realities on the ground. Objectives can be unrealistic, simplistic, unfeasible, unclear, incompatible with the stated budget or timeline. So this presentation will be a review of the assignments that Malcolm and Farm Access have given my team and I during these past weeks, and it includes a work plan, human resources management, quality improvement, and M-Health assignments. So our first assignment for Farm Access was actually for Malcolm was to design a work plan, an annual work plan for the Malawi Health System Strengthening Project proposal. And I like to call work plan the art of decrypting someone else's mind. So my teammates and I were tasked to draw an annual work plan for this project. In a week, we had to form a team, trust each other, to work collaboratively and efficiently, and actually come up with a quality work and a 20-minute presentation. Our work plan included clarifying the goals and objectives of the proposal, the activities to be conducted, a monitoring plan, a Gantt chart, and explain the resources and constraints that this proposal might encounter. So needless to say that there were several challenges, but also a lot of lessons learned for this task. The first challenge that I mentioned before was the actual team forming, getting to know each other, and readily soon after getting to work together, assigning roles, trusting each other, and the limited time that we had to form our team and actually create a work plan for a proposal that we had never read before. It was a challenge to actually understand what the authors really meant when they were writing that proposal. But we did learn a lot of lessons, especially about feasibility. I come to learn that if a proposal is too ambitious, one idea, if one has to implement it, will be to scale it down. For instance, start with delivering services to one village instead of the 3 mentioned in the proposal, and then scaling up the activity after a certain period of time where initial barriers have been overcome or some effectiveness were measured. Also realize that within a year or initial year period that the one we had, all the activities of a program cannot be launched. And I also realized that an effective monitoring and evaluation plan should come with any work plan as the basis for potential scaling up, additional funding, program extension, or assessment of programs' impact. Our second assignment was from PharmAccess, and PharmAccess tasked us to actually design a check manager position. Check stands for safety, health, environment, and quality assurance. So we were required to come up with a job description, a personal profile, salary range, interview questions, and scoring sheet, as well as newspaper advertisement for this position. It was really interesting because I personally, as most of my group members, were not fully familiar with safety, health, environment, and quality assurance, and it required searching about this job and the requirements for this position, and really putting it in the context of Namibia, so knowing what were the Namibian certifications for that position. And also, in order to improve the quality, PharmAccess reached to us to improve their patients' awareness and knowledge of their rights through pamphlets, acknowledgement form, and an exit questionnaire. The thing that I really learned from this module was the concept of a process map. So basically, I came to learn that a process map is to implementation what a logic model is to monitoring and evaluation. So before getting your head into a work, you need to know where you are, where the organization is actually, where the organization wants to be, assess the current pathways, and determine changes to be made or stops to add on the existing trajectory and the existing map. So in order to improve the quality as well, we also designed a mHealth, eHealth feedback system, patient feedback system for PharmAccess. PharmAccess access to draw on the text messaging system that they already had to design a system that will help facilitate a procedure which allows patients to lodge feedback or complain, and also for the staff to be responsible to receive this SMS and act on it. So we decided to create the voice patient feedback system, and it encompasses a tablet on mobile clinic sites for all patients and a text messaging option for cell phone users. Throughout this work, we realized all the potential issues that such a project might encounter, including network issues, power outages, cultural adaptability, reading competency, tech literacy, and cost. And the system that we designed really tried to overcome those with the tablet. Network issues, power outages could be overcome. We decided to recommend PharmAccess to use a community liaison that will help semi-literate or illiterate patient filling the form by walking them through the survey on the tablet. And we also designed the tablet to be really user-friendly and to include a lot of graphics so that a patient could really and easily fill the form. Confidentiality was maybe one of the issues that wasn't completely overcome with our system, since we were reaching the system is designed to reach patients by phone numbers, and through phone companies they can be identified. Also, by using a community liaison, there is that personal human interaction that is recommended, but at the same time it can lead to confidentiality issues. So in conclusion from the work done during these past weeks, I want to highlight the skills that I believe that somebody into the implementation field should have. And I believe that one should be goal-driven, detail-oriented, flexible, and being able to adapt as there are unexpected changes. As we communicate, we collaborate with people from different cultures, in different time zones, and change can happen. And that leads to the second point about teamwork and collaboration, I believe that everyone in implementation should realize that implementation is change, and change cannot come alone. No matter how good an idea is, other people's input, feedback, and willingness to bring change is needed for change to actually happen. And I believe that patience, as well as oral and written skills, is really a skill that should be that one should have. So before I conclude this presentation, this class is mainly about implementing programs in the developing world. And I believe that there are some specifics, differences, some specifics about such a location, such as infrastructure issues, language barriers, or cultural differences or access to resources that might not be issues if we were to implement the same program in a developed country. But I do believe that funding or team dynamics, working with people with different work styles, different temperament, it's something that is common to implementation wherever the location is. So this concludes my presentation, and I want to thank you again, Mr. Redding, for listening to it, and I'm looking forward to discussing in person with you about your comments and your questions. Thank you. Have a good day.